Did you know? What is heat stroke? Symptoms and treatment. The most severe type of heat injury, heat stroke, is a medical emergency. Give someone first aid immediately as you suspect they are suffering from heat stroke, also known as sunstroke, until paramedics arrive. Heat stroke can kill or cause damage to the brain and other internal organs. Although heat stroke mainly affects people over age 50, it also takes a toll on healthy young athletes. Heat cramps, heat syncope fainting, and heat exhaustion are examples of lesser heat-related disorders from which heat stroke frequently develops as a progression. However, it can happen even if there have been no prior symptoms of heat injury. Heat stroke is caused by extended exposure to hot temperatures, frequently in conjunction with dehydration, which compromises the body's ability to regulate its internal temperature. A core body temperature of more than 104 degrees Fahrenheit and difficulties impacting the central nervous system after being exposed to high temperatures are the medical definitions of heat stroke. Various issues affecting the central nervous system that develop after being exposed to high temperatures. Seizures, confusion, nausea, and possibly loss of consciousness or coma are other frequent symptoms. What are symptoms of heat stroke? A body temperature above 104 degrees Fahrenheit is the primary sign of heat stroke, but the first symptom can be fainting. Other symptoms may include throbbing headache, dizziness and lightheadedness, lack of sweating despite the heat, red, hot, and dry skin, muscle weakness or cramps, nausea and vomiting, rapid heartbeat, which may be either strong or weak, rapid, shallow breathing, behavioral changes such as confusion, disorientation, or staggering, seizures, unconsciousness. What first aid can help heat stroke? Call 911 or take the person to the hospital right away if you think they might be suffering from a heat stroke. Any delay in receiving medical care could prove fatal. Start giving first aid while you wait for the paramedics. Remove any excess clothing and relocate the person to a cool, shaded area or an air-conditioned space. Take the patient's temperature at the core and begin first aid if necessary to get it down to 101 to 102 F. Do first aid right away if there aren't any thermometers accessible. These are helpful strategies for saving patients. Wetting the patient's skin with a sponge or garden hose, while also blowing air over them. Apply ice packs to the patient's armpits, groin, neck, and back. Because these areas are rich with blood vessels close to the skin, cooling them may reduce body temperature. Place the patient in a bathtub or shower filled with chilly water. An ice bath can be used to assist cool the body down if a young, healthy person had exertional heat stroke while engaging in strenuous exercise. Additional precautions. Never apply ice to elderly people, minors, patients with chronic illnesses, or anyone who experienced heat stroke without engaging in energetic activity. It can be risky to do so. What are risk factors for heat stroke? Older adults who live in apartments or houses without air conditioning or with poor airflow are most prone to experience heat stroke. People of any age who don't drink enough water, have chronic illnesses, or consume too much alcohol are among other high-risk populations. The heat index, a measurement of how hot you feel when the effects of relative humidity and air temperature are combined, is closely associated with cases of heat stroke. Sweat evaporation is impeded by a relative humidity of 60% or more, reducing your body's capacity to cool. When the heat index reaches 90 degrees or higher, there is a significant increase in the risk of heat-related disease. Therefore, it's crucial to pay attention to the reported heat index, especially during heat waves, and to keep in mind that exposure to full sunlight can raise the reported heat in. When a heat wave lasts for a long time, those who live in cities may be more at risk of suffering from heat stroke, especially if the air is polluted and stagnant. Because of the heat island effect, which occurs when asphalt and concrete store heat during the day and only gradually release it at night, nighttime temperatures are higher. Other risk factors associated with heat-related illness include age. Due to their slower rate of heat adaptation than other people, infants, young children up to the age of 4, and adults over the age of 65 are especially at risk. Health problems. These include heart, lung, or renal problems, being overweight or obese, having high blood pressure, having diabetes, having sickle cell trait, abusing alcohol, getting a sunburn, or having any conditions that make you feel feverish. Medications. Among these are antihistamines, diet pills, diuretics, sedatives, tranquilizers, stimulants, anticonvulsants for seizures, beta blockers and vasoconstrictors for the heart and blood pressure, and antidepressants and antipsychotics for psychiatric disorders. A higher risk of heat stroke is also linked to illegal drugs like cocaine and methamphetamine. According to a recent study presented at the Endocrine Society's annual meeting by researchers from the Mayo Clinic in Arizona, the National Ocean and Atmospheric Administration, and the National Weather Service, people with diabetes may be especially likely to underestimate their risk during heat waves, despite the fact that they are at increased risk of emergency room visits, hospitalization, and death from heat-related illnesses. How can heat stroke be prevented? It's preferable to remain indoors where it's cool when the heat index is high. If you must be outside, follow these guidelines to avoid heat stroke. Wear a wide-brimmed hat and light, airy clothing that fits loosely. Make use of sunscreen with an SPF of 30 or higher. Drink more liquids. Drinking at least 8 glasses of water, fruit juice, or vegetable juice per day is widely advised to avoid dehydration. It may be wise to switch out water for an electrolyte-rich sports drink during times of excessive heat and humidity, because heat-related illness can also be brought on by salt deficiency. When exercising or working outdoors, take extra measures. Drink 24 ounces of fluid 2 hours before activity, and consider adding 8 ounces of water or sports drink shortly before exercise. Even if you don't feel thirsty, you should drink 8 ounces of water every 20 minutes while exercising. Outdoor activities should be rescheduled or canceled. If feasible, spend your time outside during the coolest parts of the day, such as an early morning or after sunset. Other methods for avoiding heat stroke include: keep an eye on the color of your urine. Dehydration is indicated by darker urine. Drink enough fluids to keep your urine very light in color. Weight measurement before and after physical activity. Monitoring your decreased water weight might assist you in determining how much fluid you require. Caffeine and alcohol-containing fluids should be avoided because both can cause you to lose more fluids and increase heat-related illness. Also, only take salt tablets if your doctor has prescribed them. Drinking sports drinks or fruit juice is the simplest and safest approach to replace salt and other electrolytes during heat waves. If you have epilepsy, heart, kidney, or liver disease, are on a fluid-restricted diet, or have a fluid retention problem, consult your doctor before increasing your liquid intake. What is the prognosis for heat stroke recovery? After recovering from heat stroke, you will most likely be more susceptible to high temperatures for the next week. So, until your doctor says it's safe to resume your normal activities, avoid hot weather and strenuous exercise. To avoid heat stroke, avoid lying in the sun, especially at noon, and make it a habit to drink 8 glasses of water every day. Thank you for watching, guys, and please subscribe to my channel, like, and leave a comment.